groups and their lobbyists, their high-paid lobbyists, and told them not to meet with Republicans. If they did, it would be treated as a hostile act. I'll be glad to provide that article for the record. I hope it's not true. I think it is. Senator from Utah.
I would say to the senator from Arizona and the others who commented that home health care is not the only way seniors will be hurt by this. I'm quoting from an article by Tom Scully, who was one of the designers of the Medicare Part D benefit, of the impact of this bill on Medicare Part D for seniors. Let me quote the key points of his article. I ask unanimous consent that the entire article be included in the record.
Without objection.
He says, there's a little noticed provision buried deep in both the House and Senate health care reform bills that is intended to save billions of dollars, but instead will hurt millions of seniors, impose new costs on taxpayers, and charge employers millions in new taxes. And here is the core of it. He says, quote, this fall, congressional staff looking for a new revenue source to pay for health reform proposed eliminating the tax deductibility of the subsidy to employers. The supposed savings were estimated by congressional staff to be as much as $5 billion over the next decade. It sounds smart, except that nobody asked how many employers will drop retiree drug coverage. Clearly, many will. The result is, instead of saving money, the proposed revenue raiser will force Medicare Part D costs to skyrocket as employers drop retirees into the program. And he concludes with this comment. There are many reasons to pass health care reform. There is no reason to hurt seniors, employers, and taxpayers in the process. Businesses are struggling and the Medicare trust funds have plenty of problems as it is. It makes no sense to make these problems worse, close quote. So not only are the programs going to be cut, but the drug costs are going to be dumped into the program with an increased number of people involved. You're going to see tremendous financial distortions as a result of the passage of this bill.
I yield for a question from the senator from North Carolina and then the senator from Tennessee.
I thank the senator from Arizona.
My mind goes back to a personal experience that I had that I'd like to share with my friends on the left. An entirely different bill. The bill was No Child Left Behind, and we were all for it on this side of the aisle because our president had proposed it. And my staffer said to me, listening to the debate, you know, Senator, if President Clinton had proposed this, you'd vote against it because you think it was too heavy-handed government interference. And I said, you know, you're right, and I have to do the right thing, and I was one of the few senators that voted against it. If the Democrats had proposed, if we had proposed what the Democrats have proposed, every argument we are currently hearing from the right side of the aisle would be coming with great roars and insistent statements on the other side of the aisle. But because it's their president who proposed it, they are somehow keeping their consciences under control here. I would hope that they would recognize the irony in that, and that at least one, that's all we need in order to stop this bill, at least one would recognize that conscience ought to prevail and this bill ought to be stopped. Let us be clear, if this bill is stopped, health care reform will not die as a cause. Indeed, health care reform will be reborn in a bipartisan sense of let's solve the problem rather than in a partisan sense of let's jam something down somebody's throat. And I hope that's what will happen, that conscience will prevail somewhere, and one member of the Democratic Party who feels in his or her heart that this is really a dumb idea will let his or her conscience prevail.
Senator,
I see that Republican
would the senator just yield for an observation? Senator McCain has pointed out where the lobbyists are on this bill. Senator Isaacson's pointed out where people in Georgia are on this bill. Senator Barrasso pointed out where the people in Wyoming are on this bill. We also know where the American people are. I haven't seen a survey in months, by anybody that indicates the American people are for this bill. It's not in doubt. And we've heard that President Clinton came up to their lunch And the president may be coming back himself. You know the argument they're making on the other side? Ignore the American people, make history. Make history? What I hear the American people saying to us, vote for this bill and you'll be history. This is not in the gray area. The American people are asking us to stop this bill and start over. They don't want a 2,074-page monstrosity of complexity and Medicare cuts and tax increases and higher premiums for everybody else. They want us to stop and start over and get it right.
The enthusiasm that's here, and I've noticed that the sense of passion to get something done properly for the American people is on this side of the aisle, and a great sense of defensiveness is on the other side of the aisle. We all have been caught at one time or another in the struggle between support for a leadership position or a presidential position and our own sense of what is the right thing to do. And I join with my leader from Kentucky in saying that the people of Utah have never been more worked up about any issue than this one. I've never seen any circumstance where they have been more firm and unanimous in their demand that this bill be stopped. Now, the senator from Kentucky said if there's somebody in Kentucky that's for this bill, he hasn't met him. I have met some people in Utah who are for this bill, and they have spoken to me about it as I pass through airports or I walk down the street in the hearing of other people from Utah. And as soon as anybody hears somebody vote for this bill, there is a chorus of voices spontaneously come up around that and say, don't listen to him, listen to us. This is a terrible bill. This is a terrible circumstance. I've been proud in the debate to point out that in Utah, the Dartmouth study says we have the best health care available in the United States, and if everybody got their health care there, it would not only be the best, it would be 1/3 cheaper than the national average. And I've spent a lot of time talking to the people that provide that result. Unanimously, they tell me this bill would damage that result. It would damage the quality and it would raise the price. Why in the world would we want to do those two things?
Dr. Barrasso from Wyoming.
Well, it's been a privilege to take care of patients in Wyoming for the last 25 years, and this bill is going to hurt